there have been 13 residents that were hospitalized that were vaccinated. Can you disclose anything in particular, whether it be age or anything else that they had in common that led them to be hospitalized?
I'm not at liberty to share personal health information. That is contrary to the HIPAA requirements, the health information protection rights that everyone has as an individual. I can tell you that those individuals who were infected generally had overwhelming majority a mild course with their illness. If it was a breakthrough infection in an individual who was vaccinated, that is what we're seeing nationally. Those people who are going to the hospital or dying, unfortunately, from this virus are 98% or higher unvaccinated. So generally, if you're vaccinated and you get a breakthrough infection, it's a mild cold-like illness that is passing quite rapidly with varying degrees of symptoms, from a light to a mild cold. And of course, many people are completely free of symptoms, or we say asymptomatic. They don't even know that they were infected.
Now, there are residents who are still worried about the side effects or long-term effects of the vaccines. And some are still worried about, any harm that the vaccines can harm them or cause them. I know that there's 2 deaths reported in the county who were vaccinated. Do you know of any vaccines or boosters that have played a role in somebody's death here in the county?
No, not at all. And we need to step back on the safety issue because it's very troublesome to us in public health that there is this grotesque misperception about the safety of these vaccines. And I need to emphasize a few things here. Firstly, this is not an experimental vaccine. It is a vaccine that has had a great deal of safety and effectiveness research around it. That has been quantitative research among people that the Centers for Disease Control, Food and Drug Administration, and the White House, as well as all of the state health departments, have studied very closely. And we just need to use a little common sense here. And this is what I would say to the average person. There have been about 7 billion shots of this vaccine delivered around the planet at this point. What are you hearing more about in the news? Epidemics of people getting sick and dying from the vaccine, or epidemics of people getting sick and dying from COVID-19? To me, that is the simple question that anyone worried about the safety of these vaccines needs to ask themselves. And the overwhelming reality is that very, very few people, even on a global basis, with 7 billion shots delivered, that's an enormous number, unprecedented number of vaccines delivered in this time frame in our history, as human history. And there's been no issues with the safety of the vaccine of a serious nature, where people were permanently harmed or killed, or that the vaccine contributed to their deaths. So these are so rare as to be truly exceptional. And the overwhelming benefit has been delivered by this vaccine. So I ask our residents to just step back and just look at the facts. For a number of complex reasons, this pandemic has been highly politicized, and it has been an incessant source of misinformation and disinformation, often transmitted through social media and through individuals who have an agenda other than the wellness of your family, of the wellness of American families. And the evidence is absolutely unequivocal at this time that for all age groups, including children, that vaccination is safe and effective. And for those who are wondering about whether or not they should vaccinate their 5 to 11 children, 8-year-old children, who are the most recent group we've added now to the vaccine campaign, nationally in the state and locally in San Benito County, as well as for the older children, 12 to 18, where we could see better numbers. We need to really think about their safety here. And I don't mean safety of the vaccine, because there's no side effects of significance that have been associated. Even the very rare cases of mild inflammation of the heart tissue called myocarditis is transient and goes away, often without treatment. So overwhelmingly, this is a safe and effective vaccine, including for those children. We need to remember over 600 children in the US have been killed by COVID-19. Over 6 million have been infected with the virus. 1.6 million just since school resumed in early September. So, these deaths, any child, anyone of any age that dies from COVID-19 at this point in the pandemic in the United States, given all of our access to vaccines, is a totally preventable death. Those who go to the hospital and have to be on a ventilator for days and weeks, which is not a pleasant experience, those hospitalizations are all preventable, all unnecessary suffering. So again, I want to reassure in the strongest terms that these vaccines are highly safe and highly effective, as evidenced by what we're seeing around the world, which is that slowly but surely, it's a long battle still ahead, but we are winning the battle against this virus, and we will continue to, insofar as people ignore the disinformation and the misinformation that's coming out of various corners of the community that have some sort of agenda that has nothing to do with the health of our families.
And before I let you leave, I wanted to touch a little bit too on schools. How is public health partnering with school districts and just keeping track of what's going on in schools with COVID-19?
Very closely. I and the Health and Human Services Agency Director, Tracy Belton, have a call regularly with all of the school superintendents. We are closely collaborating, providing information on all of the questions they have and direction to where they can access needed resources. The next big step in our collaboration is that those superintendents and the teachers in our schools have asked public health to organize a town hall meeting, if you will, or presentation to parents specifically about vaccinating their children 5 to 18. We are currently planning, and if the dates do not change, to have 2 nights, one in English and one in Spanish, of course, on the Tuesday and Thursday in middle of December, on December 14th and 16th, in the evening after parents get home, have been able to take care of dinner, where they can just attend via Zoom with absolutely no need to go anywhere, no inconvenience. And we will be gathering together individuals from different areas in the county, from healthcare providers. Our public health team will be presenting on all of the questions that we're actually asking teachers and the superintendents to send us those questions. And we also capture questions from when they come to our public health clinics. We have clinics for vaccination at the health department at 351 Tres Pinos Road, Mondays and Wednesdays. They can go just turn up, or they can go online and make an appointment, or they can just turn up and be vaccinated. But those 2 town halls are the next big steps in trying to educate our parents across the community, answer their questions. We'll present a series of the common questions we've received thus far for the first part of the meeting, and then we'll open it up for any questions that people who are on the Zoom at that time wish to ask, and they'll get authoritative, credible, scientific-based information, evidence-based information in response to their questions. They'll get the facts and nothing but the facts.
Yeah. And anything else that you feel that's important for the community to know regarding
Well,
vaccines, COVID, or anything like that?
Well, again, just where you started off, Noah, the need right now, given the holidays represent a significant risk. We've been seeing some good progress on vaccinating the 5 to 11 children. We're aligned with California State and nationally. I think we've bridged 10% or are above that at this point of those children. But we're not going to get to all the kids before the holidays. And while there's no question that children who get infected typically have a less severe course of illness, and they are less likely to be hospitalized or to die from this coronavirus infection. Still, as I mentioned, we've had deaths, and I can only imagine the grief of a parent with a child who could have been vaccinated, who gets infected and dies. But for the most part, children don't get severely ill, but they represent a real risk if they go and they climb on the lap of a grandparent or a father or mother after they may have been exposed somewhere at school or at sports, and they infect someone who is not immunized or who is only partially immunized or who hasn't had a booster shot yet. So children, we want to target now very intensively for vaccination, both to protect them. There should be, to me, no children dying in the United States from this infection, but we also want to vaccinate the children to protect those individuals who, for whatever reason, even at this late stage, remain unvaccinated. And really, Thanksgiving and Christmas is one of the highest risk times of the year for getting not just this, but other respiratory infections, including influenza. And that would be the last thing I would offer, is that I encourage everyone in the community this year, even more so than a usual year, please get vaccinated for influenza, because we do not have yet any evidence. We haven't had enough experience, because the masking last year and the year before worked relatively well in reducing the influenza epidemic, that we see every year. We have a seasonal increase of flu in the United States every year. 40, 48, 50, 60, 65,000 people. That range of people are infected every year from with the influenza virus, and there are deaths among them. Those people. Every year, thousands of people die from influenza. What we don't know this year that is most concerning to clinicians and public health authorities alike is what happens to the individual who is infected by both COVID-19 or the SARS-CoV-2 and the influenza virus. Now you have not one, but two very seriously potential malignant viruses infecting your lungs. What will they do together to damage people and to prevent them from recovering and sending them to the hospital, potentially killing them? So this year, I really urge all of our residents in the community to get their flu vaccine, and as soon as possible, please, as well as get vaccinated against this coronavirus.
Well, I appreciate your time, Dr. Geller. Thank you so much.
It's been my pleasure. Thank you.